Now, experts say Metro Manila may now be in the early stages of a new outbreak driven by the Delta variant. Let's check the situation on the ground. Joining us now is Dr. Jonas del Rosario from the Philippine General Hospital, the largest COVID-19 referral center in the country. Good evening, Dr. Del Rosario. I want to start with your latest Facebook post about the status of COVID cases among vaccinated healthcare workers, which was shared by more than 2,000 people and counting. Your message is obviously clear that vaccines do work. What prompted you to put out that message?
Well, this is in our preparation for the Delta variant induced surge. We were looking at our healthcare workers and basically looking at the status of our vaccinated healthcare workers. How many of these vaccinated healthcare workers, including employees of PGH, actually had breakthrough infections. So breakthrough infections are those who, in spite of being vaccinated, they will acquire the disease. And we were happy with the results because as of today, we have about 6,052 fully vaccinated healthcare workers and employees of the Philippine General Hospital. And we look at the numbers. Initially, as you know, there was a surge sometime in March, and we had about almost close to 270 healthcare workers having COVID-19. And then it decreased to about 160 in April. And then when we were already rolling out our vaccination, so we saw a significant decline. In May, we only had about 26 of our healthcare workers being infected. And in June, another 28. Of these 54 healthcare workers who had been vaccinated, actually 23 were fully vaccinated. The most important information we got from this data was that none of our healthcare workers who were fully vaccinated suffered severe or critical COVID. Almost all of them either were asymptomatic or had mild COVID. There were a couple who had moderate, but all of them recovered. So the bottom line is we felt like the vaccine helped our healthcare workers to be able to fight off the COVID and at least being protected from severe or critical condition.
Dr. Del Rosario, talk to us about COVID cases among your patients in PGH. No, I'm not sure if you have the similar data as what you had presented about your healthcare workers, but do you are also monitoring in terms of those who have been vaccinated or remain unvaccinated at this time?
That's actually a very good question. We are still looking into it. Looking at our patients, how many of our admitted patients now are unvaccinated. I cannot give you exactly the numbers, but what I can tell you is I was told that all of the patients who are in the ICU right now, close to 20 patients in the ICU of the Philippine General Hospital are all unvaccinated.
Doctor, our neighbors, Indonesia, Malaysia, Thailand, which are seeing record high numbers of infections and deaths, many of the healthcare workers there also received Sinovac, as many of our healthcare workers in PGH also did. Now, their governments now are switching to Western brands, either as a second dose or even as a booster shot. What do you make of these reports?
Well, you know, PGH received Sinovac. About 2,000 of our healthcare workers received Sinovac, and then 4,000 received AstraZeneca. We are not encouraging people to get a booster at this time. And with this data, it only proves that you are protected from severe COVID-19. And so I think by doing a booster shot right now, you are depriving some of those who haven't even gotten the first dose of the vaccine.
Doctor, how is PGH preparing for what experts fear a possible resurgence of COVID cases due to the highly contagious Delta variant? We've seen what had happened in India and Indonesia, patients being turned away in hospitals, oxygen tanks running out. What's the worst case scenario PGH is looking at?
Well, we are anticipating and bracing ourselves for a possible surge, so we are trying to cover all bases. First, we're looking at our facilities. looking at the ventilation of the hospital, improving the COVID wards. We are actually upgrading some of the rooms. We are ordering some more equipment to beef up our supply. We're making sure that our oxygen supply will be enough. Making sure also that as much as possible to encourage more of our healthcare workers who haven't been vaccinated to get the jab. We're about 85% of our healthcare workers fully vaccinated. We are also going to open in the near future our new emergency room. And then about 2 to 3 weeks from now, we will be adding a COVID isolation facility, about 40 beds to accommodate more patients.
Dr. Jonas del Rosario, as always, we appreciate your time and take good care.